You live. Okay, so Senate Health and Welfare, we're back. And now we are looking at bills that are ready for possible votes and markups. So thanks for being here.
You're welcome. Okay. Let me see if I will share.
We're gonna start with S 206.
Share.
2.1.
3.1.
Right.
I don't know what's going on, but it's not giving me the option to share from Word or from. If everyone has it on their iPad?
We do.
Okay, then I could just speak and we won't put it on the screen.
Yeah,
That's okay.
that's
okay.
It'll be, people who are on the screen will have to access it on our webpage.
Okay. So this is draft 3.1 of S 206. This is your bill pertaining to the licensure of early childhood educators. If you remember, we gone through this a few times and you asked for a few changes based on input that you were getting. So section 1, no changes. This is the section that lists all of the OPR professions. Section 2 is where the Board of Early Childhood Educators is set up and the new chapter is created in Title 26 for licensure. So I don't think we had any changes in the board language. I'll go through that quickly. Section 3 is where you put the rest of the content into the chapter on early childhood educators, not just language about the board. So you have your definition section. And here is a change that was requested from OPR page. I'm on page 6. This is the definition section, and yep, we're in subdivision 8. And a program or program regulated by CDD means a program or facility approved by the Department for Children and Families Child Development Division as a licensed or registered family child care home or a licensed center-based child care and preschool program and is not operated by a public school. So if there was child care programming operated by a public school, it wouldn't qualify as a program under this language. Okay. You have your prohibitions language, exemptions language, and there is similar the corresponding change in the exemptions. So we have a list of who is exempted from licensure. And there's a third item on the list, and that is an individual who works exclusively in a public school.
Question for the chair. When do you want to get into the discussion? Now, let's go through the bill after we.
If you have questions about this for clarification, then you could ask now.
It's not really a clarification.
Okay, so we'll come back to it and we'll get part of discussion. All right.
Okay, I'll keep
I'm
moving.
like
One moment.
trouble of brewing.
Never leave the room.
Another change, we looked at this last week. I'm on page 11, moving down to 12. So we had a variance section. And the bill as introduced only had one variance, and that was in what is now subsection A. And now that is subsection A1 and 2. And then the new language we looked at last week was this highlighted language at the bottom of page 12. In addition to the transitional licensure available pursuant to subsection A of this section, the board shall also issue an ECE 2 license for individuals who have completed the eligibility requirements set forth in 6221A and D. So that's the GED or high school diploma, age majority, and exam if the board decides to have an exam. So if they've completed that and completed one of the following, they could be eligible for an ECE 2. So 21 college credits in core early childhood education competency areas identified by the board and rule, or prior experiential learning that is assessed to be 21 college credits. And this language, we know, sunsets after 8 years. So those variances are available for 8 years. Disclosure by licensees. The change you're seeing in section 4 is to use, the same language throughout, so variances instead of transitional license. I made that change when I made the change up above. You asked for this new language on a report back. So on or before November 1st of 2031, the Office of Professional Regulation is to submit a report to GovOps committees, Health and Welfare, Human Services, on the implementation of this new chapter, including the number of licensees by license type, the state resources necessary to implement the chapter, the number and nature of any complaints or enforcement actions against a licensee, the qualifications required for each license type, and any other issues the office deems appropriate. And then in section 6, this was our language on appropriations and positions, and just updating the heading to reflect the fact that there are positions in it. And then the request was to remove language about legislative intent for fiscal year 28. So that language has been removed from this appropriation section. And then the effective dates have been updated to include the new section on reporting, and then the updated type headings throughout the bill. So that is it for changes.
Okay, now, questions?
So.
You have a budget or a comment?
Not for me, it's not a question.
Okay.
I'll wait until everybody
Well,
can watch it.
Let's go questions first, and then we'll go comments, and then have a discussion.
Currently, how much do the payroll taxes generated? And I don't know if you know that, I'm probably looking at the center over there.
Actually, we looked at it in appropriations. Yeah.
Okay,
It's a lot.
and about how much money is currently going towards this program?
The money doesn't go to this law. It goes directly to support people who are percentage of poverty to help. It goes to the child care centers to pay for
Okay,
kids who are coming in.
okay,
So that, the goal of the payroll tax was to reduce the cost.
for those individuals,
Yeah,
depending on which FPL percentage you're at.
right. It's not administered, don't pay it to the people, but it's administered.
It's going to the child care center.
Yes.
Yeah, what we've been finding is that at $45,000 a year, many families couldn't afford childcare. And coming out of COVID, that was one thing the business community told us they needed childcare because their workers weren't
Coming
coming
to
out.
work, yeah.
And a lot of the centers closed and if they stayed at the level that people could afford, then they couldn't afford to pay a decent wage. And you got this spiral where you couldn't get people because you couldn't pay them, but to charge enough to pay your staff, people couldn't afford it. So the payroll tax, and there's a whole table, subsidizes the cost
Right.
for people up to 300% of poverty, but at that it's like $10 a week. And I was just sent, it's on my phone somewhere, a story on how Vermont has,
The New York Times.
done this to make childcare affordable.
Yeah. New York Times had.
But it doesn't go in to this program. It actually subsidizes the parents.
Okay, so I get that. With these changes, with this policy, well, this is a policy, right?
Yeah.
So this policy is going to cost something.
So within the bill itself, you'll see fees.
Yeah.
That are being charged for
Yeah.
licensure. Usually what happens when we have programs like this is that the fees pay for the program itself.
Okay.
So there might be some upfront money needed to get it going, but then after that, this is something finance has to do. Figure out
That's what I was thinking.
how much is gonna be, how much is needed to support the program in the Office of Professional Regulation. That's actually a question you could ask Warren Hibbert if you wanted to.
Do you want me to answer?
Yeah, go right ahead, you can say it.
For the record, Lauren Hibbert, Deputy Secretary of State. Madam Chair, was absolutely correct. Traditionally, our programs are supported by the licensing fees that are charged. And we have a special fund for OPR. This is a board profession, so the fees are siloed by profession if it's a board profession, and within the OPR fund. And the fees that are generated are intended to cover the entire cost of the program. That means licensure, both applications and renewal and related staff, policy work and related staff, and enforcement complaints that we receive about the profession, which include, screening those complaints, investigating those complaints, and prosecuting those complaints.
So basically, the payroll taxes are gonna go up pending that. Due to this bill,
That is not anticipated.
It's not in the bill at all.
just to pay for these two positions, I can't remember, you got stuff in the.
Those two positions we're asking for a general fund allocation. I don't believe that it's even specifying that it comes out of the payroll tax at this time, but we're asking for a general fund allocation so that we can hire people before we receive any fees, so that we can set up the profession, because we need to have an executive officer for this profession and also an attorney to do the rules.
That's what it says.
Yeah.
Okay, so
And the cost that's in that bill, I'm sorry, the cost that's in that bill is the cost of those two positions for one annual.
in the 262 from G.
That's correct.
Okay,
That doesn't mean there won't be an effort to raid the childcare fund. There was one last year, right?
really?
Well, the childcare
I
fund
mean,
right
there's
now,
money.
it may not happen. It's pretty well,
Established.
Yes, we held the line.
A lot of
money.
Okay, so who pays the fees again? Anyone that's applying for these types of licenses?
Currently,
Here's a renewal fee.
Okay,
yeah, it's every 2 years.
every 2 years.
Yes, and it's the individual who pays. Now, there have been discussions in previous bills of using the payroll tax money for 2 years, 3 years, 4 years of those licensing fees. That's not in this bill. There have been conversations about various organizations paying those licensure fees. That's not in this bill. There's been conversations like, for instance, the hospitals pay for a lot of their staff licensure fees. That could be a model for childcare as well. But again, that's not in this bill. The way that this bill is drafted is the individual who's obtaining the license would pay the licensure fee.
But it doesn't prohibit the board,
That's not
the
prohibited.
individual childcare place saying, I'll pay the license fee.
And we anticipate that that will happen in a wide variety of circumstances.
Thank you.
any other questions? Okay, so, now it's time for discussion.
Okay, so as I look at the bill, I think it's great that the folk who provide early child care, education want to be recognized and hold a license and so forth. That I support 100%. What I'm really concerned about, and I sort of mentioned this in the past, is as this occurs, what I see is the cost for early childhood care is going to go up. These people who are going to get licensed are now going to have a marketable commodity, and they're going to want to get paid more for providing those services, which is great, but we already know that it's hard for people to afford child care. So in order to not put that burden on the public, what we're going to probably see is an increase in how much we need to collect in the program to support this, because the cost of the program's going to go up. So that's my first concern. My second concern is, if we make this mandatory, it means anybody who wishes to enter into this field is going to have to take on a greater education responsibility and so forth, which is a cost to them. It's gonna be a time piece. And the question is, are we going to see a decline in the number of early childhood educators? Don't know. The jury's out on that. We won't know for a period of time. And we already know there's a shortage. So, and the other thing we heard is, well, this will be a way of making sure that these people are qualified and that they are held to a standard. Well, if I'm running the business, I'm going to make sure my employees are doing the right job. I don't need the state to come in and oversee my employees if I'm doing my job as an employer. And the facility itself already has a license and is held to a standard. So we have a check and balance already built into the system. So I don't look at that as something that this bill plugs a huge hole. What I would prefer to see, this is just my opinion, is that this moves forward on a voluntary basis where people can become licensed and we monitor that for a period of time to see what does that do to the cost of early childhood education. How many people actually want to go get their license? And again, if I'm an employer of a facility and I want to market my facility as being the best place for you to put your child, I'm going to want people who are certified so that I can say, come to my facility because my people are trained in early childhood education, and your child is going to get the best care and growth and development by being here. Again, I don't need to be mandated to do that. It would be something that I would do if I were running one of these facilities. So I just think instead of mandating this, is allow a period of time for the industry itself to evolve, develop. We are able to monitor it. We get that report with maybe a few added pieces in it at the end of that period that looks at, have we seen an increase or decrease in child care facilities, or an increase or decrease in number of participants? How many people have gotten licensed? How many haven't? So we can make a more intelligent decision upon whether this should move forward with a mandatory program or whether the voluntary program actually gets us to the goals that we're trying to achieve. So there's my stump speech.
Okay,
I'm gonna look to you for history. But I've been in and out of this committee, and also I spent 6 weeks once on appropriations. We started with the STARS program, right? And that was similar environment, and that you get STARS. And there was requirements that you have an associate's degree, and Jane Kitchell was very active in that. But what we didn't do is put any money in, so we required that you
do
get
all
an
that.
associate's degree and you didn't get a raise, which caused problems. And this is kind of growing out of that now. This is formalizing what's already there. And there is VSAC. What is it called? The Vermont Green Star. VSAC has a scholarship for 2 years.
No, there are
to community
scholarships
college.
for
Yeah, I
child
think it's
care
called
workers.
Green Stars or Vermont Stars.
We did put that in.
But you can get the money.
Well, is there anything in the bill, Katie, that requires a child care worker to have any specific degree? I mean, does it say you must in order to work in a child care center?
There's specific requirements.
Yeah.
So let me pull it back up. So
Um, and I will say, as we're talking about this, what is in the bill has actually come from the child care professions and professionals to please do this for the reasons that you stated in the beginning. And I completely agree with that. So it's not a matter that we're taking this out of thin air. It's really, I think it's a continuation of what we saw with the STARS program, that what we saw as we built the child care bill, as we put the scholarships in place, and all of it has coalesced around this is a profession that needs to be respected, but then also validated, and this is the way of validating.
But it would be helpful if you could get a history, because I think this has been like 10 years
Let's ask,
as
So-
regulatory.
can I phone a friend on that?
Oh, that's what I'm hoping.
So I'm looking at a couple of people in the room who would like to say something about getting us a history on this.
Well, for the record again, Lauren Hibbert, I can provide some history on this, but I think Emily
That's fine.
might be better served on the long financial history and career ladder. But what this bill is doing is building on what currently exists within CDD. This requires certain qualifications for particular roles in childcare centers. That is also true right now within the CDD division of DCF. There are requirements for specific roles. This takes those requirements, in some instances, is building them to a higher level. And we've talked about those levels quite a bit, the bachelor's for ECE 3 and the associates for ECE 2. That concept of the variances, which Legislative Council has really been working so hard on with us, provides that period, that 8-year period, to allow people multiple pathways into the profession based on their current experience. And if they want to get the associate's degree, time to get the associate's degree. This committee did hear from the colleges, from CCBD, about the strong attendance that they have in their early childhood education program, and the fact that almost all of those individuals are receiving that associate's degree without cost to them through scholarships from CDD, from Northern Lights, from the Early Childhood Educators Association. So I anticipate that all of that support will continue for people who seek either the 21 credit pathway or the associate's degree pathway during this 8-year period. And the other piece that I would just leave you with is that report back is within that 8-year period, so that we will be able to see, are we getting this right? Are there adjustments that need to be made? And I guess the other piece, I said one last thing that I want to say, which is always a fatal flaw. The other thing that I just want to say is the Office of Professional Regulation, the reason why we are recommended a license and not certification, which is what you're talking about in our Sunrise review, is that we found that there was significant enough public harm that individual licensure should be required, that the risk of harm to young Vermonters who are in childcare really shows that we need individual accountability, not just at the facility level, so that when somebody does something that hurts a child, which happens, I mean, we've had several really public news stories about it. It's at the individual level that there's accountability, not just the facility. And we found that there was not only just that type of harm, but, you know, poor care, subpar care has huge impacts on someone's future readiness for kindergarten, truancy in high school, criminal justice involvement in their 20s. I mean, it goes on and on and on, that the foundation, and you've heard some really great testimony from providers on how much neurodevelopment is happening between 0 to 5. And some of that is happening in pre-K, which is regulated right now. but there's a lot that's happening in 0 to 3. So those are the reasons why we recommended licensure. I'm happy to talk more about it. But in terms of the history, the voluntary sort of certification of stars, I'm going to turn to Let's Grow Kids because they know it better than I do.
Emily Tenenbaum, Let's Grow Kids Action Network for the record. I will go high level and then in the STARS history and the engagement of the field, I'll go over to Cheryl and from AOIC. I'll be super quick. When we look at the cost, I look at the cost of if we do nothing in this moment, and the cost is really great because we are looking at staffing shortages. I think both of you referred to that. And this from data is the most important thing we can do as a next step, as a follow-up to Act 76, to make sure when we get New York Times accolades, it's affordable, it's really bringing that to our state. And the single most important data point we're looking at is how do we retain and recruit the talent and the people in the room. I have a 4-year-old. Like, what are the professional standards we can put in place so parents know what to expect, that our childcare owners and directors have a pathway to make sure we that we have them both retaining them and recruiting them. And it really is the single most important step. And that's why you're seeing this bill in this moment. And so I ask you what the cost of doing nothing in this moment is. And I think we need to make sure that we really look at the data, and this is the single next step. Yes.
So because it's after 12 o'clock, we're going to finish up today. We're going to come back to this bill tomorrow for possible vote. We also have S243 and S210 that we'll put up at the same time. The discussion that I'm hearing really reflects on, we heard a lot of testimony that will answer some of your questions, Senator. So I encourage you to look at that, and also as we're getting ready for these other bills to do similarly with the bills that we've had before us. We'll come back to this tomorrow and